again for joining our small group LA focused on connecting health and broadband. I'm Katie Hydorn, Executive Director of Insure the Uninsured Project, or ITUP. I know most of you are familiar with us, but we are a health policy nonprofit, and we've been working in this space for 18 months, going on 2 years, and really excited for the discussion today. This is our second discussion on broadband and health in LA. Last week, we did an overview just to level set for everybody in the health world, talk through some vocabulary and engagement opportunities and just high level what's going on in LA County. And the group really expressed a lot of interest in anchor institutions and how you become one. And then also, I know we've got folks on here who also do advocacy. So today we have two fantastic speakers who we've been working with and have been had the pleasure of being their partners in LA for the last 18 months or so on this, but they're doing the real work, and both have fantastic knowledge and engagement opportunities in this area. So I'm going to share my screen and after we do introductions, go over a little bit high level, again, just to level set the purpose of this group, and then I'll turn it over to our wonderful speakers, Amy Cortina and Shana Englund today. So if we could do some introductions, I think that would be great. We have a really nice diverse group of folks on here. So I'm just going to let my team introduce themselves first, and then I will go around the screen. So Marissa, do you want to go ahead?
Hi, everyone. Thanks for joining us. Marissa Kranek, ITUP Director of Policy. I'm excited for the conversation today.
Thanks, Marissa. Let's go to Peter.
Hello, everybody. Peter Mackler. I serve as Executive Director of Healthcare Policy at City of Hope Comprehensive Cancer Center. Good to see everybody.
Thanks, Peter. Thanks for being here. Let's see, Amanda.
Hi, everyone. Amanda Clark. I'm Director of Programs with the Safety Net Institute. We're with the California Association of Public Hospitals and Health Systems, and we represent all the public hospitals and health systems across the state.
Thanks, Amanda. Deanne.
Good afternoon. My name is Deanne Cuellar. I'm the Community Broadband Network Outreach Lead at the Institute for Local Self-Reliance. And I apologize that y'all heard me sneeze and listening to my bread machine. I'm doing too many things at one time.
It's okay. And Deanne's also in a different time zone than us. So Deanne, thank you so much for making it work today. Let's see. I'm going to go with Emily next.
Hi, everyone. Sorry about that. I am Emily. I am ITUP's Director of Programs. I do a lot of things for ITUP, including our programmatic work and our annual conference. And I'm mostly here today just to meet you all and to hear a little bit more about ITUP's evolving role in broadband. I'm excited that we're undertaking this new adventure.
Thanks so much, Emily. Let's see. Amy, go ahead.
Hello, Amy Cortina with Unite LA, a nonprofit dedicated to advancing education and workforce efforts, but here also with the LA Digital Equity Action League, as Unite LA is a co-convener with the LADC for LA Deal.
Amy, amazingly enough, wears many hats and does a great job at it. So happy to have her here today. Speaking of many hats, Shana, why don't you go ahead and introduce yourself?
I'm Shana Englund. For purposes of today, I'm the Director of the Digital Equity Initiative at the California Community Foundation.
Thanks for being here, Shana. Let's see, Debbie, go ahead.
Good morning, or good afternoon, or evening, wherever you are. My name is Debbie Arthur. I'm with Visión y Compromiso. We're a statewide network of promotoras here in California. Nice to be here. And I'm here representing Maria Lemus, who couldn't be here today.
No problem. Thanks so much for being here, Debbie. Irv, please go ahead.
Hi, everyone. Irv Hoff, IT Program Manager at Kaiser Permanente.
Thanks, Irv. Let's see, Kelly.
Good afternoon, everyone. Kelly Bean here with HealthNet, legislative advocate, but also interested in learning more about how ITUP is engaging on this work and hopefully getting some of our provider partners in the community in LA to be anchor sites. So here to learn more.
Excellent. Thanks so much for joining, Kelly. Great to see you. Warren.
Hey, thanks for having me today, Katie and team. Warren Berdine, I'm the CEO at Eisner Health, a federally qualified health center with sites across Los Angeles County, and always interested in how technology links our patients to care.
Thanks so much for being here, Warren. Let's see, Nancy.
Hi, everybody. I'm Nancy Clifton Hawkins, and I am the Director of Community Benefit at City of Hope National Medical.
Perfect. Thanks for being here, Nancy. Let's see, Kathy, go ahead.
Good afternoon, everyone. Kathy Martin. I'm with the Association of California Healthcare Districts. I'm the CEO of the association. We represent 76 healthcare districts throughout California, and I'm sitting in for Sarah Bridge, our senior legislative advocate, who couldn't make it today, but has been very involved with this work and has promoted this work in our association throughout our membership. So I'm happy to sit in for her today.
Thanks, Kathy. Sarah's been a great partner to us at the state and local level. Let's see, Courtney.
Good afternoon, Courtney Bacalso with Kaiser Permanente. I'm an IT project manager.
Thanks for being here, Courtney. Kaylin.
Hi, my name is Kaylin. I'm a grant writer at Downtown Women's Center in downtown LA.
Wonderful. Thanks so much for joining us. Ivy.
Yes, hello, and good afternoon, everyone. My name is Ivy Padua. I'm Senior Director here at Kaiser Permanente Capital Projects Delivery IT. Here to learn.
Thanks so much for being here, Ivy. Let's see, C-Ping.
Hi, I'm Si-Ping Chow. I'm with, sorry, accidentally muted myself, the National Office of Community Health, working on social health member interventions. And glad to see you, Ivy, and other folks from Kaiser. Thank you for joining today.
Absolutely. Thanks, Si-Ping. Let's see, Lily.
Hey, Katie. Hi, everyone. Lily Dorn with the Community Clinic Association of Los Angeles County. And as our member Warren said, you know, digital equity is critically important to health centers continuing to deliver care to their patients.
Thanks, Lily, and just so greatly appreciate your partnership. Been so incredibly involved in this. Let's see, just a couple more. We've got William.
Bill Gomez, Kaiser Permanente, Southern California, or CPD.
Thanks so much for being here, William. Jocelyn.
Hi, everybody. Good afternoon. Jocelyn Cuesta, California Program Director for Small Business Majority.
Thanks for being here, Jocelyn. Stephanie.
Hi, everyone. Sorry for my dogs barking. Anyways, the mail's being delivered. But my name is Stephanie Fiore. I'm at Elevance Health, formerly Anthem Inc., and also a fellow Angelino. So certainly excited to see what's going on in these initiatives. And then Elevance Health is looking forward to doing some testing in the States or some other ways to extend. We've got the great opportunities of the ACP and the NATIA funding. All states have signed up, but there are some gaps that we're curious to see how we can all kind of like work to fill, especially when it comes to devices and whatnot moving forward. So certainly happy to learn and then see what we can do to advance digital equity.
Great, love it. Thank you so much for being here, Stephanie. And Linda. Please go ahead.
Hi, I'm Linda Randolph, and I am in the Division of Medical Genetics at Children's Hospital Los Angeles, and I have a strong interest in telehealth with Jennifer Raymond of endocrinology here. It's and I'm on the virtual care committee, so I'm very interested in the work that all of you do and making the work relevant to the broader community.
Great, thanks so much for being here, Linda. So thanks, everyone. Really appreciate the introductions. I always like to know who's on these calls and let you all hear who's on these calls as well, because it's everyone working in the same, with many of the same people in LA. So thank you again, all of you, for your interest in this. I'm going to share my screen real quick and just sort of level set why we're all here, and then we'll get on with our speakers. Okay, so again, we're here to talk about health equity and the digital divide. Just a little bit of background again on Insure the Uninsured Project, if you're not quite familiar with us. We're an over 25-year-old nonprofit, and we have long roots in LA. We've been in the LA community for over 25 years. We were founded there. We're now headquartered in Sacramento, focusing a little more on our policy work. But we continue to have deep roots in LA with a couple board members in LA, as well as running the LA Health Collaborative, which many of you are also engaged in. So appreciate you jumping a little outside of the health and human services box and coming into the broadband world. We believe that all Californians should have a fair opportunity to live their healthiest lives, and that our health system is universal, equitable, accessible, effective, and affordable. All those vision and values, I think, really tie into seeing broadband as a social determinant of health, and really going upstream and making sure that we have connectivity so that we can do all the wonderful things with virtual care that we're all excited about. We have several policy areas, and I think the most relevant one for this conversation is our technology and data conversation. This has really emerged as a key policy focus for us and important to our other initiatives: coverage, access, and delivery system transformation. So our purpose here with this meeting and this series of meetings that we're doing is really to make sure that we're bridging that knowledge gap between healthcare and broadband. I feel like in healthcare, the last 10, 15 years, we've really focused on making sure that all of our medical records and data work, and that now we're moving a little upstream into the broadband conversation. And I think for me, this equation really solidified after COVID, when we really focused on virtual care. So making sure we have connectivity so that we can do virtual care, and hopefully that results in better health outcomes in the future. We really want to make sure that we're identifying and activating around health sector engagement opportunities, making sure that you all know where to engage, with whom to engage, whether that's at the local level in LA, which is what we're really going to talk about today. And then at the very end of our agenda, you'll see that we actually have some state level opportunities as well. So appreciate you all thinking through this. I know many of you work on both the local level and the state level, so hoping to provide you with very concrete ways to actually engage in this conversation. Again, this triangle, we can't take credit for it. I feel like Deanne Cuellar, who is on this call, really inspired this. There are really three legs to the stool of digital equity: connectivity, devices, and digital literacy. And that, for me, as a non-broadband policy expert, really crystallized it for me. And then, of course, we're focused on a lower income and more vulnerable population, so equity and affordability really underpin all of our work in this area. I think a few key takeaways as we start to engage in a conversation today about infrastructure and advocacy opportunities. This is going to take a long time. So even though the broadband community is already out there and there's a lot of work going on, there's still plenty of time to engage at both the local, state, and if you really get excited about this, at the national level. We've got middle mile projects and last mile projects. So those big highways of data, our I-5s, our I-99s, that's the middle mile infrastructure. And then the last mile really gets us into the communities, right? Gets us out to our anchor institutions, which then can broadcast internet or build internet to the home. So there's plenty of engagement. We call broadband the gift that keeps on giving. If you want to engage somewhere, we've got places for you to engage and learn. And then, of course, there's that whole digital equity, digital literacy conversation that is on top of the infrastructure conversation. So again, we have these opportunities with these roundtables to learn just a little bit more. So our agenda today, we're going to start with Amy Cortina, who introduced herself, to talk about really becoming an anchor institution and what that looks like. And I'll let her tell you more about the LA Digital Equity Action League. But they are really the entity that's coordinating a lot of and liaising and communicating with both the California Public Utilities Commission and the California Department of Technology. And then after that, we're going to talk a little bit more with Shana about digital equity and inclusion and some of the advocacy efforts that the California Community Foundation, a local foundation in LA, is leading, both at the local level, and I'm sure Shana will get into the state level work as well. And then we'll close out just with some next steps and a few state level engagement opportunities in the next couple of weeks if you want to pass those along to anyone who's working at the state level. So with that, I'm going to stop sharing. And let's see, I think we had one more person join us, and then I'm going to hand it over to Amy. Bruce, would you mind introducing yourself real quick? See if he's listening.
Sure. Bruce Pollack with MLK Community Hospital.
Great. Thanks so much for joining us, Bruce.
Sorry I'm late.
No problem at all. Thanks. We're just getting started. Amy, go ahead.
Hello, good afternoon. So many of you, I recognize many of you are new, so I'm just going to give high level overview of what LA Deal is before I answer the questions of what is an anchor institution and how can you engage as one. So the LA Digital Equity Action League was developed last year and formally designated by the California Public Utilities Commission as our region's regional broadband consortium. So the PUC has a program that they fund every region to have one of these consortia. And the role of the consortia really is to bring funding for last mile infrastructure projects to their regions. Historically, Los Angeles hasn't had this consortia role. The previous consortia, which ended in 2018, focused on digital literacy. So this is really the first time we would be going after infrastructure dollars that a lot of other regions have been getting tens of millions of dollars to connect their unserved and underserved households. So right now, LA Deal is developing out a list of potential projects based on what we've heard from community, based on the California broadband map, which I'll go into later. But we've been convening partners to learn from you all where there are gaps. That's kind of high level overview, but what does it mean to be an anchor institute? So I had to actually look that up, confessing. But according to the Federal Communications Commission, a community anchor institution is a school, a library, medical, healthcare provider, public safety entity, community college, or other institutions of higher education and other community support organizations like CBOs. And agencies that provide outreach, access, equipment, and support services to facilitate greater use of broadband service in vulnerable populations, including low income, the unemployed, and the aged. So LA Deal currently works pretty closely with the LA County Office of Education. We work closely with LA Unified School District. We have had conversations with a county library. We work closely with the city library system. So we have begun to have conversations with some community anchor institutions, but in all frankness, none from the healthcare sector. The state of California actually does provide funding for community anchor institutions one is a federal program, the E-rate program, and that's primarily for schools and libraries to provide internet to students. And when the pandemic happened, it allowed for wireless technology to be covered under the E-rate program. Now school systems are trying to get that changed forever, but there's still kind of barriers with that, so that schools are seen as providing internet beyond just their walls. The California Teleconnect Fund, which is through the PUC, is a funding program that provides 50% discount for eligible organizations to have broadband service. So these organizations include public schools, private schools, libraries, CBOs, hospital and clinics, health clinics, community colleges, and California Telehealth Network. So I looked into that program. I can send information out after this, but the application looks simple enough. You all might be already receiving some of those funds, but just in case you are not, that could be helpful, especially I think they're directing these programs mostly at rural areas that have low service. So how does LA Deal drive local infrastructure and community-based broadband solutions and decisions in LA? So the way that LA Deal identifies where we should prioritize our energy is through really primarily our stewardship committee members. Our stewardship committee is formed from Council of Government representatives, so Gateway Cities COG, the South Bay Cities COG, the San Gabriel Valley COG, and we have representation for the San Fernando Valley from the Valley Economic Alliance. We're still currently working on a representative from the Antelope Valley, but really with the idea that these regional representatives would help identify where there are gaps in service and where there are gaps in infrastructure in their regions. We know that they don't know all. So we're also working with the county internal services department, which they have their plan. They've identified communities that have 20% or more households that are not connected and are focusing their resources in those communities. So we are trying to align efforts. The city has a plan as well. The school district is currently working on a contract with AT&T and Charter Communications to provide students who are not connected with free internet for the next year. However, in executing this project, the district is learning that there are areas that are not serviceable by AT&T or Charter Communications, even if those households wanted to get signed up. So we're learning about where those gaps are. That will help inform where we prioritize different projects. And of course, joining us on this call too, Shayna with the California Community Foundation has been instrumental in bringing community-based organizations and other nonprofits working with underserved, unserved communities together. And through those conversations, we are learning about where there is need in community as well. Additionally, we hear about different projects. I'll give another example. The Lucas Museum reached out to us about a year ago and connected us to Destination Crenshaw and said, look, there's this project. They're doing amazing things, but they lack reliable internet and they lack internet in certain places. And I think, you should really support them. So we started a conversation and brought in ITUP, and ITUP brought in Connect Humanity. And now it looks like Destination Crenshaw is putting together a broadband plan for their area to deploy infrastructure. So that's just an example of how a project can come together. And then while very flawed, but improving, the California broadband map, and I can send a link to that broadband map, shows where in the county, well, where in the state, but you would only be concerned with the county, there are providers, either one provider, two provider. It gives you kind of a detailed map of how, like at what level people are receiving service. Unfortunately, right now it's focused on census block data, not household block data. And so it inaccurately depicts where there are holes. So there are some places of the map where we know service is not there, that the map shows there is service. However, the state recognized that, and they're working on improving the map with household level data. Hopefully, beginning of next year, there will be a better map. So those are kind of the different ways that we learn about areas we should be prioritizing for CASA funds. And then there's a question about what are the best ways for folks, for healthcare folks interested in becoming anchor institutions and community broadband solutions to engage with LA Deal. So I think if you're still kind of on the fence and you're still in learning mode, I would say come to a task force meeting. We have an infrastructure task force meeting every month that really focuses on what is currently happening at the state level and at the local level around broadband infrastructure. It's an opportunity for community to share about what they're working on or where their needs are. It's also an opportunity to identify potential collaborations and coordination of efforts. However, if you know you're fully bought in and you want to get started and start exploring what that looks like to be a community anchor institution, let's have a one-on-one discovery conversation. LA Deal is working with the state to develop out their middle mile open access network. So the middle mile open access network is going to ensure that last mile projects are more attainable to communities that don't have sufficient network build out. So right now we're trying to identify where in the county that middle mile should go to position communities for last mile projects. And part of that is identifying internet access exchange points. So really looking for buildings that have specific specs, but to be honest, they're not complicated specs. They're, I don't remember all of them and I can send that out easily. But it's like a small room that needs to be cooled at a certain level and needs to have some sort of security and electrical capacity. But I would assume most hospitals have that. And so I don't even think that would be a barrier if you wanted to be an internet access exchange points. The third-party administrator to the middle mile open access network has said that they'd be happy to identify how spaces could be reworked if you think you have a space to accommodate an internet access exchange point. So I think that's a potential opportunity. And then, like I said before, last mile projects for CASF and federal funding account dollars. If there is a community that you are in that doesn't have reliable internet, doesn't have 25 free internet, or that it doesn't have internet at all, then let's have a conversation. Either we might have that community on our list of potential priority projects, or it's something we need to add to our list, and we can explore what other partnerships we need to bring in. And then finally,
we got a question actually.
Oh, okay.
So is Internet Access Exchange Point different than serving as an anchor institution? Is that right?
I think it's a part of serving as an anchor institute. I think being an anchor institute can mean many different things. There's not one like specific scope that you abide by in order to be an anchor institution. So, yeah.
Sounds like a very individual, local conversation. Amanda, thanks for that. It sounds Amanda has many public hospitals, like county and publicly owned hospitals, and that have clinic networks as well. So I'm sure it'll be different depending on different locations. But yeah, if someone's interested, it sounds like that's a great conversation to have. Amy, did you have one more thing? I did want to make sure we had a little bit of time to let Shana talk, and then we can just ask general questions.
Just one last point. So I just want to elevate something that's happening in the county that I do see a role for healthcare systems to play a part. The LA County, LA City, and LAUSD have entered in MOUs to share assets. So infrastructure assets. This is pretty innovative, and it supports some of the infrastructure projects that they are investing in, so that the city's light poles could be used towards a community wireless network, or to support LAUSD's network build out. So I do think hospitals, there is a potential there that the healthcare system be able to utilize some of their infrastructure assets towards network development.
You're muted, Katie.
Thanks, Emily. Maybe this dovetails nicely into the question in the chat. So what are those priority locations? Do you have a map in LA, or are we still working through that?
Yeah, we don't have a map. We have a list, and I'd be happy to share that after this. There are about 20 locations, but I would say probably 8 to 10 are really much more feasible for CASA funds.
Great. Amy, thank you so much. I'm going to hand that, please keep putting your questions in the chat and we can make this a discussion. I'm going to hand it over to Shana to give you a overview of CCF's work at the local and state level on this. Shana, go ahead.
Thanks, Katie. Is it bad form to have a quick slideshow? Just to keep me moving?
Please go ahead. You should definitely be able to, if you can't share your screen, let me know and I can give you.
It looks like I can do it. All right.
Cool. Got it.
All right. Hopefully folks can see it and I can make it a show so that, there we go. And Katie, you'll holler at me if folks aren't seeing what I think and hope they're seeing. The only other things anybody would be seeing would be a giant spreadsheet of price discrimination. So I wouldn't be bad, but not also bad. Probably not a great intro.
No, great.
Okay, thank you. Hello, and thank you for having me. And it's so fun. It's always good to follow Amy, who I feel like I spend more time with than my husband these days. And also so good to see you, Lily, and the others that we've been doing a lot of this work with. So delighted to be here. Thank you. So just very quickly, for those who don't know us, the California Community Foundation is the kind of official community foundation for LA County. We are kind of at the tail end, as you can see, of a $1 billion commitment to the future of LA. And we really see our role as supporting systems change solutions that improve the quality of life for all Angelinos. And the Digital Equity Initiative is a multi-year project. We started out as a 3-year project. We have now grown into a 5-year project, and we're at the very beginning of year 2 to seed and support a digital equity movement in LA County. And the, again, sort of started pretty narrow, but as we got into the work, has expanded, but really still focused on broadband equity and making sure that that access piece of that 3-legged stool is real. And ultimately, our ultimate goal is to have fast, reliable, and affordable internet for every Angelino. And just that kind of a quick note on origins. So the CCF got a pretty sizable chunk of money with a very broad mandate that was identify the systems change solution that has the most potential to have the most impact on recovery and an equitable new normal post-pandemic. And so went on kind of a listening tour of grantees and partners and allied philanthropy. And the really interesting thing that happened was kind of 2 things. One is digital divide or digital equity. That phrase appeared nowhere in the survey or in the discussion guide. And that phrase didn't often come up in those conversations. But what did come up was examples of where this inequitable access or the digital divide was an absolute brick wall against progress. On education, we've all heard those stories. Immigration, we had things like our immigration attorneys saying that they had clients who were going to jail or were getting deported for failure to show up for a hearing when they couldn't go to the hearing because it was online and they had no way of accessing that. And then all of you are very familiar with some of those barriers in the health space. And again, whether you use the term digital equity or you use the term digital divide, what we found again and again and again was this kind of systemic lack of access to fast, reliable, and affordable internet was absolutely a barrier. And the flip side of that is that's an opportunity for systems change. So that's the kind of origins of the initiative. And just to kind of give you a big sense of what that looks like across LA County, this will come as a surprise to probably no one on this call, but lack of internet access maps almost perfectly against basically every other social determinant of health, household income, race. I could put a whole bunch of other maps up here that are kind of environmental factors, food deserts, everything else. So digital inequity in LA County looks like every other kind of inequity in LA County. And so the root causes are not entirely dissimilar. We identified root causes, at least on this, again, this kind of access leg of the stool, as one, digital redlining, which is kind of shorthanded systemic racism and discrimination that's built into the very infrastructure, the actual tubes, if you will, of the intertubes. And you can see the map there is the 1939 redlining map and the kind of hot spots of where there isn't fast, reliable, and affordable internet available. Again, almost a perfect map. And then what you're looking at in that little diagram on the right is kind of the whiter, wealthier communities in Glendale between 2004 and 2014, 2017, went from kind of a little bit of competition to many options across the whole community and very little fiber to about 50% fiber, which is the kind of best technology available. Compare that to on the top row, South LA, Watson, Compton actually lost some competition within the region and had absolutely no fiber upgrades. So those are just 2 kind of examples of the evidence of digital redlining and what that looks like. We also saw industry capture of the policy and regulatory process as a root cause. Really kind of community and folks like yourselves are almost never at the table when these decisions are being made, but industry lobbyists absolutely are at every single table. So that looked like a root cause to us. And then lastly, we're still trying to come up with a good label for this, but kind of big picture narrative misdirection, right? There's a ton of really bad data around there about what drives this. There's a lot of jargon. It's a very technically complex space. And it creates a lot of room for the blame and the focus to be on individual choices. So poor people only access on the internet on the cell phones because they want to. That's the only thing they want, which we know from survey data, we know from on the ground experience is not true. But in this kind of context, that is a kind of narrative misdirection that can take root and can really drive attention away from important systemic change. So that's kind of where we as an initiative are coming at it. And just as a, not to get you all into my spreadsheet hell at the moment, but just to give you kind of a sense of what does that mean if we kind of take those root causes and we translate it into something that is a kind of very real consequence on the ground. What you're looking at here is a very, very small sample of a pretty massive data set that we're building that basically demonstrates that if what you want is fast, reliable, and affordable internet, you should move to Pacific Palisades or Beverly Hills, where Charter Spectrum, which is most of us, that's our only option for internet in LA County, reserve their very best offers for Beverly Hills and Pacific Palisades and other kind of census tracts that have the lowest poverty rates. And if you live in a high poverty area, you're going to pay a lot more for less good service. That's just, again, a very kind of concrete example of how all of these kind of systemic drivers result in real on the ground consequences. So over the past year, we've built a coalition. There's actually some new logos that need to go on here, which is exciting. It is my very, very great luck to get to spend every day working with the leaders of these kind of amazing organizations. I think an important thing to draw attention to, and that actually makes the LA coalition somewhat unique from across the country, is that we have very little in the way of specific digital inclusion or kind of organizations that have digital equity as their primary issue. If you look across this logo set, including a bunch of the folks that are on this call, it is folks that have some other equity, some other justice, some other service focus that, again, saw the same thing as we found in our listening tour, that the digital divide is a barrier to meeting their primary mission. And we really think that is a plus for us building an effective coalition around this, is really rooting the solutions to the digital divide into the supporting the lifestyle equity justice of our residents as a kind of supporting system and not as the kind of primary driver. So we work every day with, and I'll get into a little bit more about kind of what we do with this amazing group of people, but just a nod to some of the other things that we support statewide. So two things. One is we are a founding partner along with Common Sense, Next Gen California, the Rural County Representatives of California, RCRC, Michelson 2020 Philanthropies, and Media Alliance are the founding partners of the California Alliance for Digital Equity that just formed a couple of months ago. And we're trying to do is build a statewide coalition that can be a kind of durable, sustainable counterweight to the California Cable Television Association and CTIA and some of the really big lobbying places that have the kind of industry voice that has been so kind of extra loud over the last, call it 30 years. So that formed in the last 3 months, and there's some really interesting work happening there we'd love to engage folks on. And then the second is CCF is a founding partner along with Michelson 20 the Silicon Valley Community Foundation, the San Francisco Foundation, the Bay Area Air Quality Management District for some reason, and a few others, in creating a pooled fund to support technical assistance activities to help folks, again, who don't have digital equity or don't have broadband expertise as their number one thing, really engage in these issues. So I would love to be able to come on this call and be like, oh yeah, I just came off a call with you, and we just into this meeting, and I'd love to be able to say hi by name to everyone on this call and more. And here's how we do that. We do kind of three different places that are available for kind of quick and easy engagement, in addition, of course, to LA Deal, which we partner really closely with and are huge supporters of. But we do a lot of advocacy and policy engagement. We do that at the state legislative level. We, again, support folks in engaging at the California Public Utilities Commission, at the FCC. And then, of course, there's a ton of work happening at the county level and locally. And at least some of that advocacy can drive the way that you as anchor institutions can engage. So one very specific or two very specific examples. One is we're doing work again with LA Deal. Amy, I think we're on this call tomorrow in the Antelope Valley. And there is a co-op forming that is a partnership between the health district, school district, cities, town councils, and others to actually bring a homegrown broadband solution to the Antelope Valley. And anchor institutions will be a really vital part of that. There will also need to be advocacy both at the county level and at the PUC to ensure that that can go the way it needs to go. So the way that the community wants it to go. So that's one example. And then another is again in Destination Crenshaw. Jason Foster and his team there are building again a homegrown kind of community driven, community responsive solution to provide more broadband options in that kind of catchment area in Crenshaw. And there are several key hospitals, there's health district, like there's a lot of places where folks on this call could be actively supportive as anchor institutions. And that could range from kind of, as Amy was mentioning, providing space on your building for an antenna, more or less, to kind of signing on to and being a founding partner in that project. So lots of things happening on the advocacy and policy engagement space. We're also working very hard to try to make all of this information a little more accessible. So we're doing Broadband 101. What does it mean when we talk about fiber? What does it mean? Like you will, I promise you after you do one of these, you will never look at a power pole the same way again. Because you will then know, you're like, is that fiber or is that coax I'm looking at? It's almost certainly coax. So we're doing Broadband 101 training sessions all the way up to like kind of Broadband 401 for different organizations. We are hosting every other week kind of office hours with a PUC expert to answer questions about what's happening there. And that could be a place where folks could bring their anchor institution questions. We also are producing and are always open to partnering to produce more one-pagers and primers and things to just make all this information a little bit more accessible. And then lastly, I have to bring you all into spreadsheet hell with me before I get off of that, before I finish, but we are doing a lot of work to try to kind of document what this really looks like on the ground. The place that has kind of gained the most momentum is on the pricing question. What are people paying for what kinds of internet in what communities? We have a cost survey that I linked to there that is kind of grassroots, that we're looking for 1,000 data points. And I think we're at just under 600 right now. So assistance in getting more data points into that cost survey is welcome. And then we have a number of other kind of initiatives in that same vein of really just trying to round out the data piece and what are we actually talking about. So I will end the show, end the slideshow, and happy to answer any questions or turn it back over to others who can better answer them.
Dana, thank you so much. Just so impressed with how, having watched this for the last 18 months, just the coalition that you all have built and the effort, it's just really incredible to see that moving forward. We have a couple questions to kick this off. One, is the deck available and can we share it with the group? Is that?
Yeah, of course. Okay,
perfect.
Yep, I'll send it over.
Thank you. Irv, yes, the answer is yes. I just wanted to make sure. Thank you for, we dropped in several links over here to some of the work that Shannon mentioned, CADE, the CCF Digital Equity Initiative, and then the pooled fund TA details. Lots of really wonderful help here to learn more about it. So I'd love to, Amy, talk to us about how to get connected, whether it's a one-on-one conversation or a task force meeting. We'll make sure that we send out information on how to do both of those. Also happy to connect you directly to Amy if that's something you want to do and would like ITUP to help do. But Shannon, can you talk to us specifically about if folks want to get engaged, if they want that broadband one-on-one with you, if they want to do some local LA advocacy, or if they want to connect into either Antelope Valley or Destination Crenshaw, if they happen to have a hospital or a clinic or other community sites in those areas, what's the best way to do that?
I am popping my personal email and my cell phone into the chat right now, and just get in touch and we'll figure it out.
Great. We'll send that out as a follow-up and make sure Shayna's email is available to everybody. Careful what you wish for, Shayna. All All right. So any questions that you'd like to ask either Shana or Amy, or any just general questions for us? Okay. Lots and lots of information. Courtney, I do see that you're unmuted. Did you have a question?
Oh, no, I'm sorry.
Okay. Just making sure. Warren, thank you for your comment. I know you're having some actual connectivity issues, so thank you. Yeah, remarkable and enlightening. There's a lot going on in this area. So glad that this is helpful. Before we all sort of sign off, I did want to give you an opportunity to just know that there are a couple public comment sessions coming up, specifically actually at the state level. So for those of you who are working at the state level on this call, or have state level representatives, in addition to what we're doing in LA, there's an opportunity to engage and bring that community voice to the state policy conversation on this. So I'm gonna share my screen here real quick and walk through it, and you can ask any questions you have as well on this. I think they would have figured out the not starting at the beginning of your presentation through all of this. So just a couple upcoming engagement opportunities with links and suggested public comment for how to begin to engage. There's a middle mile advisory committee meeting. Amy talked about this, the really big infrastructure conversation that's going on. It's been ongoing, but they desperately want health folks to be on. So there's a meeting actually this Friday. It's very easy to do public comment. You just type, we have the link for you too. You just type your comments in a box and send them off during the meeting. They meet every month. And then there's also the California Broadband Council meeting that gets a little more at that last mile work that Amy was also talking about. So what they're doing at these two state level meetings actually set the policy for what's happening at the local level. And they also tie into the California Public Utilities Commission work that Amy and Shana also mentioned. But there is a state broadband action plan, and they're actually going to be talking about an upcoming stakeholder process. California is getting $4 million to do a state digital equity plan. And so they're really interested in making sure that there's health folks at the table. And that's not this Friday, but the Friday after. So lots of great opportunities to come in and talk. Here's actually the public comment link. It'll look like you can do a Q&A box on a Zoom, but they really actually want you to type them into comment boxes. So this is how you do it. And then the suggested content for public comment, and would love from Amy and Shana if there's anything else you want to hear from health entities, either for you or for our state level folks. Generally we think it's just important to show up at this point and say, hi, we're here, we're from the health and human services world. We want to learn more about anchor institutions. Maybe we want to be them. We want to make sure we're on your middle mile map. This is who we are, who we serve. Again, I think equity is front and center for all of you. And so that's really important. And then tell your story. Why is broadband important to a health entity? We're also working with folks behind the scenes, starting to get health and human services language into this, not just community-based organizations, but being very specific about health as well. So if you have questions about that or want to engage, please let us know. This is sort of our call to action today, right? Connect with LA Deal, either one-on-one with Amy, or sign up for their task forces, or make sure the right folks at your organization are engaged there. Definitely get involved with Shana at whatever level you would like. There, as Shana outlined, there are so many opportunities, and she really does have fantastic partners who are doing technical assistance. So if you have folks who want to give comment at the California Public Utilities Commission, Shana is an expert at this, but she's also brought on people to help her work with everybody who wants to give those types of comments. So there are just so many opportunities here. And then if you want to get involved at the state level, or your teams do, there are also those state level pieces. And then I think we're planning to continue this series. We'll probably do at least another meeting in August and another meeting in September, just to continue this conversation. So more to come. Amy, Shana, anything else to add before we jump off? Shana.
I think the only thing I would say is just as an indication of how much your voices are needed and how much of a difference you really can make just even by showing up to a meeting every now and then. Amy and I were part of a coalition meeting yesterday with Speaker Rendon, an in-person meeting in his office that got scheduled, I think like 2 days after we asked, which never happens, which is a good indication of kind of where the priority level is. And his response to a question around how can we balance out kind of the industry voice, how can we make sure equity stays center, how can we make sure our communities are heard, is he said, one, coalitions are the way to go, and two, make sure that you have a kind of broad coalition, have like unexpected voices, and that are voices who haven't been engaged before. And certainly kind of looking around and at the participants list, there are a lot of voices on here that are really well respected that are not usually in this conversation, and so would be very powerful, either as Public Utilities Commission comments or kind of joining us on sign-on letters or in conversations with legislators, and we will happily prepare you and help you with all the technical assistance that you need to do that, or your teams. But just being at the table is hugely powerful, and we heard that directly from Speaker Rendon yesterday.
That's wonderful. Thank you, Shana, and appreciate the the invitation to be at those tables. So it's great. Amy, anything else to add?
How do you follow that?
No, we can't.
+1 to Shana.
Yeah. Thank you both. It's the work you're doing is incredible at every level. A couple questions in here. How can we amplify the message of others? Warren, we can definitely follow up offline, but we'll, there are lots of opportunities. CCF has some wonderful explainers. We also have a couple we have a short slide deck. We also have a short Broadband for Health 101 that we're, in the process of also refreshing to help, take that. If you do have partners also who are interested, they can start coming to these meetings as well. Let's see. And then Debbie, who's supporting promotoras. I do think to do from this is to connect you in actually probably with LA County's Internal Services Department. They're working on, they have a whole Delete the Divide presentation, and they're very interested in digital navigators and community health. We've been talking to them about community health workers. So I think they would really welcome that kind of a conversation. They've said that they want to do a promotora model, and so making sure that you're connected with them, I think would be great. All right, seeing lots more messages. Thank you all, and if you have any questions, I will be following up with you via email. So thank you all, really appreciate it. And again, huge thank you to Amy and Shana today for being on the call and sharing all of their expertise and engagement opportunities with us. Thanks everyone, have a great evening. Bye.
So much.
Thank you.